channel. So my name's Alex. I'll be doing a head-to-toe assessment on my teddy bear. Before I begin, I check the patient's chart and medical records. And then before I go in patient's room, I check for any isolation signs. And if there isn't, I'll go in, knock, Joe in, and then close the door. I would courtesy for privacy, and then I would introduce myself. Hello, my name's Alex, and I'll be a student nurse today. And today we'll be doing a head-to-toe assessment. It will take around 15-20 minutes. I get your name and date of birth. Then I'll verify that with the armband on the patient's wrist, and then it matches the armband and matches the medical record. After that, I'll begin asking questions. So, do you know what day it is? And do you know where you're at? And what brings you here today? So, if the patient was able to answer all those questions, he'll be learning rotated times 4. So, and then he doesn't need a mini mental health assessment because he's all there. Now, do you have any allergies before, or any medications before you begin? No, and do you have any concerns? On a scale of 0 to 10, are you having any pain? And 10 is being the worst pain of your life. Okay, so he's not having any pain. Then after I ask those questions, I start doing his vitals. So I have all my vital equipment right here next to me. First, I will check the patient's blood pressure. To check the blood pressure, first you get the systolic palpated. And how you do that, you just put the blood pressure cuffs on normally. I will use the brachial artery. It's like show it on myself. It's right here, and then make sure the arrow is pointing down. After that, I'll pump up the blood pressure cuffs and feel for the systolic palpated, and then after that, I'll add a 30, and then wait 36 seconds, and then take the actual blood pressure. So, after I take the blood pressure, when taking the blood pressure, I would need to use the stethoscope to listen for the pulse. So after taking the blood pressure, I would have to use the oral thermometer to check the patient's temperature. To do that, you have to turn it on, stick it underneath the patient's tongue, and then tell the patient to wait till it's done beeping. So once it beeps, you would have the patient's oral temperature. Gotta document that's oral. After that, you check the pulse. So if this is a real patient, I'll check the pulse, and I would say the normal limits probably 80 beats per minute. Then while I'm doing the pulse, I notice that I also count the respiratory rate without telling the patient, and then I'll call that 16, and I noticed that the pulse is 2+ bilaterally, and then I would go down and check the pedal pulse too, but first check for any edema on the leg, and then check the pedal pulse. So the pedal pulse is 2+ bilaterally, and I expect that the patient they're wearing clothing appropriate for the season, and skin color is appropriate to ethnicity, and the gait is patient's able to sit up erect. So now for the actual assessment. So I'll tell the patient that I'm going to go start on top of their head and tell the patient, so I'm going to test for cranial 7, tell the patient to close their eyes, and then smile, and then frown to check for if the cranial is intact. Then after that, I would have to tell the patient to bite down, so feel the temporal mandibular joint. And then next, I'm going to palpate. So I'm going to palpate their head, their neck, and then this supraclavicular place for the lymph nodes, and then palpate their carotid artery, both sides bilaterally. 2+, you don't want to do both at the same time. Then check for cranial 11, and so I'll shoulder to shoulder against resistance, and tell them to turn their heads left to right. So after that, I would have to inspect the ears, check for tenderness, and then check for any skin tear or lesions. Next, to check the eyes for the sclera and conjunctiva. So I'll use my flashlight and then check if it's white, the sclera, and check the conjunctiva if it's pink. Okay, after that, I would check the mouth. So with the mouth, you would inspect first. You notice any cracking or any dryness. If it's not, the skin color is not pink. It shouldn't be white. It shouldn't be blue. Cyanosis. After that, you'd tell the patient to open their mouth. Then you would check for the tonsils or uvula to go up. And then while you do that, you could also check their teeth and their gums, see if any swelling, and see if their teeth's good, healthy mouth, the lips also. And after that, you tell them to stick their tongue out for a counting of 12, and move side to side, and then you would know if there's any tremors or not. And then one last thing with the mouth, or two more, you tell the patient to swallow, then notice if they could swallow or not, and then next to gag reflex, use a tongue blade, stick it like around halfway to the mouth, and it shows a gag response. Now going down from the head, you do the lungs. So for the lungs, you would inspect first on the expiration and inspiration, see if they're breathing normally, even expansion, and you also check for if they're having any labored breathing, and if not, you could write that down. Then next is you have to palpate for symmetry. So you put your hand like this and watch your thumbs. It should be even. So it goes out even. It's good. And after that, you have to start auscultating. So when you auscultate for lung sounds, you have to use the diaphragm, and then you go 5 times in the front. So what do I mean by that is you go 1, 1, 2, 2, 3, 3, 4, 5. And lungs, like when you first start, you start like all the way up next to the clavicle, because the lungs are all the way up here. And for the back now. And while I auscultate the back, I would also look for any ulcers, not ulcers, skin tears. And so I will start up here, and then go 1, 1, 2, 2, and slowly go down the middle. 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, and 9, 9. Okay. After I'm done with the lungs, I'll go to the heart next, my cardiac assessment. So with that, you would inspect the patient's precordium area and notice if the skin is appropriate for ethnicity. It is, and then palpate for temperature. No signs of hyper or hypothermia. And then next you start auscultating after you check for any skin tears, any skin color, and palpate for temperature. So for the cardiac assessment, when you listen to 5 areas. So aortic, pulmonic area, Iris point, tricuspid, and mitral. And then you do that for a diaphragm. So you note that the S1 and S2 sounds are heard most in the aortic and pulmonic area, and then you listen for extra sounds in the same areas. Usually just listen to extra sounds. So aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And then you would palpate for the point of maximal impulse. Should be like at the apical area. After that, you tell the patient to. So that concludes the cardiac assessment. Now we're doing the abdomen assessment. So you have to let the patient relax. So you lay them down and put your knees up, so their abdomen is nice and relaxed. And before you begin anything, and before you begin the assessment for the abdomen, you first inspect. So you're gonna inspect for any masses, hernias, anything that's bulging, and then you gotta see if it's symmetrical, the abdomen is symmetrical, and see if their contour is flat. So after that, after noting all of that, and then see if there are any striatal lesions also, you now could auscultate for bowel sounds. For bowel sounds, you have to use the diaphragm, starting the right lower and up, then down to the 4 quadrants. And then you gotta listen for, if you don't hear any sounds, you have to listen for a full 5 minutes before you document absent bowel sounds. And then you will palpate rotating direction, 1 centimeter deep in each quadrants. And then you fill in for masses, bulges, anything. You sit the patient up. After that, you could do the neurological assessment. So you tell the patient to touch their fingers like this, faster, back and forth, and then to test the round test. Then after that, you could tell a patient to do this on their knees too. So if they pass that, next is to test the deep tendon reflex. So I don't have the equipment, so I would use my stethoscope and hit their tendon, and then it should be normal response should be hyper or hyporeflexive. Then now test the Romberg test. So for the Romberg test, you would tell the patient to stand up and put the patient towards the bed, so it's behind them. Let the patient know that, and then let them know they're in front of them. Tell them to close their eyes and put their arms out for about a minute, and then the patient should be able to hold their balance. And to finish the test, we would tell the patient to walk around the room to test their mobility or gait and look for if they use any medical equipment. And this patient doesn't have a Foley catheter, nothing's wrong with his GU. And that concludes my assessment. Lower the patient to the lowest position, get the patient call light, tell the patient if you need anything, just press the call light. And do you have any questions before I leave? No, and then do you want to leave the door open or close for privacy? Then so I'll close the door, gel out, and then go chart